So unfortunately, the causes of perinatal mental health difficulties aren't actually clear to us, but there are definitely some links and some relationships between things. So your mental health history can tell us a little bit about what the perinatal period might be like for you. So there is no hard and fast rule. All we know is that if you have, for example, struggled with anxiety in the past, you will be slightly more likely to struggle with perinatal anxiety. And the same with depression. And then things like if you've struggled with bipolar disorder, there is a higher likelihood that you might develop things like postpartum psychosis. So your mental health history will give us a little idea as to whether or not you are more likely to develop a perinatal mental health disorder. Having a baby is a really difficult and really stressful time, and if you have not got a support network around you, the emotional and physical strain on you is going to be higher. So if you haven't got a supportive partner or a supportive family around you, then that's going to be difficult. So what we would say in this time is to just try and ensure that you do have some people around you that you can go to that can support you. If you don't live near family, perhaps book in for them to come up and visit you, stay with you when the baby is born or in the couple of weeks after. And our own childhood experiences will directly impact on how we experience parenthood. So if we've grown up in a difficult background, there's been abuse, neglect, difficult family dynamic, loss or trauma, the feelings that we have about those events in our lives might get transferred through as we become parents and we start our own families. So it's quite common in this time when having a baby for things to be kind of re-triggered and projected. So our attachment styles, how we feel about family, all of that starts to replay. So it's a really good idea, if possible, before having a child to try and work through some of those childhood experiences. The way we feel about ourselves, our own self-esteem, can then have a direct impact on how we feel about ourselves as a parent. So if we don't feel that we are very capable, we don't feel like we're very good at coping, we might interpret our baby's cry as I've done something wrong. It's incredibly difficult to feel strong and empowered and confident and containing for our children if we don't have any faith in ourselves. And then stressful living conditions or major life events, big bouts of stress during pregnancy or early motherhood can obviously have an impact on how we're feeling. So if you are moving house, going through a relationship breakup, you've lost somebody close to you, or you're worried about finances or where you're going to live or who's going to be around you, if there's high levels of stress, if there's high levels of anxiety, if there's lots of adrenaline coursing through your body, then you are much more likely to develop perinatal anxiety and depression. So it's trying to keep life as calm as possible, which is very difficult during this period, but as calm as possible whilst you go through this perinatal period. The actual cause of diagnosable perinatal mental health conditions isn't really known. So we know that there are some links between the things that I've spoken about and developing mental health difficulty during this time. But just because you've experienced anxiety in the past does not mean that you will definitely experience perinatal anxiety. And just because your family don't live close doesn't mean that you're going to experience postpartum psychosis or depression. There are slight links. What we're saying is try as best as you can to look after yourself during this period.